Welcome back to Dental XP. I'm sitting in the lounge and I have with me Dr. Sergio Rubinstein, who many of you know already from the site. He's given us many programs and kind of nice varied programs because he's both a periodontist and a prosthodontist, so really a kind of versatile clinician and one that we really enjoy talking to because his involvement in all aspects of dentistry. And actually, as he and Maurice actually do many cases together, he was here discussing one of them this morning and was talking about a product that he uses quite a lot, and we thought we'd like to introduce you to it yet again on XP. And this is a product that you've been using just a short while, as far as I gather.
Yeah, I've been using it for about a year, but again, I would like to thank you for the invitation and the Dental XP audience. The way I started using Progenicin, it was given to me, and it was actually sitting on the shelf for a good 4 months before I really opened the box. Why this took place actually was out of necessity. My office manager had a herpetic lesion on her lip, and she was quite embarrassed and upset that she had this situation, and she wanted to get rid of it. She used different products that are in the market, and nothing took care of it after 4 or 5 days. I was out of the office. So when I saw her, I said, this is a good opportunity to try the solution. So the way the solution comes about is in a small vial, and they recommend to actually cut the tip. My suggestion is that instead of cutting it, I'll recommend to puncture with an explorer on the inner part. And right now, they have a new presentation which actually has a small white plastic cover, so the solution is not running out.
And that works nicely.
So it's very nicely because it does cover and it's not running, and you can give it to the patient for whatever solution has not been used
and then
at the time of the
seals.
appointment. So it's a very nice way to preserve some of the remaining solution. And this happens to be my office manager. So she came into the office in the morning looking this way and was not very happy. As you can see, none of us would be. So I said, let's give this a try. And I saw her at 8:06 in the morning. And we put the solution, practically 2 or 3 drops, just dab them in. And the next picture that I took was the same day, practically 7.5 hours later. The herpetic lesion was practically dried out, which normally we know could take about easily 10 days, 14 days. So she did not like the way it looked, but she could actually feel that it was actually drying out. Pain was practically eliminated after about 3 hours. And she knew that this area was starting to heal. In about 2 days, the lesion was practically gone. So we're very enthusiastic about it. So I said, maybe this is really promising, and there's something that we can utilize in other situations. So then I went into clinical scenarios where I saw any kind of irritation that the patient had. Sometimes the trauma from food that we eat, or many times will be because when we take an impression, we pack a cord, or we do electrosurgery. We apply this solution in the area, and the discomfort is practically eliminated if the patient had not been anesthetized, truly in just a few minutes. Of course, if the patient is anesthetized, what we like to see is that when the patient comes back a few days later, that any of the irritation that has been created is practically gone, independently of the symptoms. The patient that we see here in the very last case on the right side, she called me and she was in pain. The irritation we see on the surface around the premolar didn't seem to be so big, but the patient was in pain. We applied the solution, and about 20 minutes later, the patient called me from the car saying, I don't know what you applied, but the pain is completely gone. I wanted the patient to come back to the office 2 days later to evaluate how the tissue looked, and she did not want it to come back because she said, it is gone.
It's fine.
So today, the applications for this solution is practically more universal on anything related to any tissue trauma. We're talking about periodontal surgery with an implantation cover, or when there's sutures involved. At the end of the procedure, we like to see the application of the Progenicin. And when we take an impression, we like to apply this solution around the cord prior to the impression taking, as we believe some hemostatic properties could be a part of the healing process, as well as when the case is completed, any kind of irritation, we apply the solution in the affected area.
So if you've got a couple of sutures and you put it around the sutures, just at the knot or just across all the...
Well, we just cover the entire area. What we see is that the tissue heals significantly faster with anything else because there are different products out in the market. And we feel that the discomfort from the patient is drastically reduced, as well as seeing clinical results, which is what we always look for.
That's great. Temporaries, you're using it when you put temporaries on into the sulcus after you put your temporary on, and then just syringing it into the sulcus, leaving it there for a while, and then you ensure the patient obviously doesn't rinse afterwards.
Correct. We tell the patient not to rinse for about 30 minutes. If the irritation is significant, we know that we're not taking impression at that time. So many times that we're not able to modify how the tissue is responding, we like to use this as well as an intermediate step. And when we're done with the provisional cementation, remove all the excess, we apply again a little bit of the progenicin, and we just tell the patient not to rinse for half an hour. The results that we have seen clinically are great, and the response from the patient has been wonderful.
And then you give them the rest of it to take home?
And sometimes we'll give them an extra vial if we feel that they may need to utilize these 2-3 days later, as it is in the case, for example, that there's no periodontal dressing, and we want to gently apply a few days after, we'll do that.
Be great for grafted areas, for anything like that.
Anything that's related to soft tissue trauma, we feel that this is absolutely a wonderful product.
Well, great. We will start to use more of it. As you know, we've used it just for a short while ourselves. And one of them, you saw the case, he was dramatically different. Literally within, 10 minutes, he noticed the difference. It was actually one of the doctors in the office.
Yes.
So, Sergio, thanks for sharing that, and great to be with you again.
I appreciate it. Thank you very much.